Hi, this is Jen Rubin, editor-in-chief of The Contrarian. Delighted to have with us back Congressman Jake Auchincloss from the Massachusetts 4th Congressional District. Welcome.
Jen, thanks for having me back on.
Absolutely. You recently wrote a piece called or about the cost disease. What is that?
Cost disease says that inflation is not spread evenly across the economy. Inflation is concentrated in a certain number of sectors that inflate way faster than wages do overall. So, for example, TVs have gotten a lot cheaper over the years, but hospital services and housing have gotten a lot more expensive. And so the middle class today spends about half of its income just on healthcare premiums and housing alone. And my theory is that Democrats need to focus on curing housing and healthcare and other sectors that are afflicted from cost disease. Well, how does cost disease happen? Cost disease happens because some sectors have very low productivity growth and are very labor intensive. And I'll give everyone a thought example here to help clarify this. Imagine that you built your car the same way you built your house. So you stood in your driveway and you called up a general contractor, and the general contractor came over and you told him what kind of car you wanted and how far you wanted it to go and what color and all that stuff. And then the general contractor called a bunch of subcontractors and they hired a bunch of workers and they built your car in your driveway, piece by piece. Ask yourself whether you think your car built that way would cost more or less than the factory built cars that we have today. I think most people would say, boy, that car would cost a lot more. And it's not fantastical because actually by economic complexity, cars and houses are actually relatively similarly complicated. The difference is cars are manufactured and houses are constructed. And construction productivity has gone down since the year 1960, whereas manufacturing productivity has gone up by about 800%. So the key to cure cost disease is to take things that are services, things that are projects like construction, and turn them into things that can be manufactured at scale, either automated or built in factories. And we can do that. We can do that in healthcare, we can do that in housing, we can do that in energy, and thereby lower housing, healthcare, and utility bills for the middle class.
Now, many people would say, well, that's great, but what happens to all the people who are doing the separate little parts of building your car or building your house? Does this lead to unemployment?
No. What we have seen is that the adoption of technology and of new economic processes always creates new kinds of jobs. Now, I'm not going to say it's not disruptive. I think that's disingenuous to say that it's not disruptive. It can be disruptive, but that is the role of a strong and capable public sector, is to embrace cutting old regulations and adopting new technologies in order to improve standard of living and lower costs, but to do so in a way that does not create a pool of winners and a pool of losers, but rather allows everyone to enjoy lower costs going forward. We know, for example, that the movement from farms to factories that characterized the late 19th century was very disruptive. I think it's hard to argue, though, looking back, that it wasn't overall a boon to US economic productivity and to the creation of a strong middle class. We then saw a movement from factories to offices. Also can be disruptive, also probably increased productivity. Now we're seeing, I think, a next wave, in some ways back to factories, but building things that used to be services. And that can be disruptive. It can also lower costs.
And what are the kind of government policies that would help promote this? I can think of education and tech training, so you have a skilled workforce. I can think of lowering, not raising tariffs, so you have a good exchange of goods and services. I can see a legal immigration system that works. What are some of the other things that are possible to help speed this along?
Absolutely. The first thing I think is humility. A lot of my colleagues in Washington, D.C. want government to run a command and control economy where it picks winners and losers. And right now you're seeing that in full force with the crony capitalism of this MAGA tax and spending bill. But, you know, in our own version, Democrats can do this too, where there's, I think, too much hubris about what Washington, D.C. knows and can accomplish in a $30 trillion economy. I believe in simple but not easy. A sound currency, reasonable, broad-based, low-rate taxation, the swift, fair administration of justice, things that are the very sinews of competent government, but that frankly have been degraded over recent years. Like, let's focus on the basics, and we're going to be astounded by what a market economy can accomplish. There are, of course, specific programs or policies that we should pursue. I'll give you one example, one only, and that is zoning and land use reform for housing. We need to build 5 million units of housing over the next 5 years to try to lower costs for the middle class. We can't do that with our current zoning and land use paradigm. We got to make it much easier to build, in particular, those missing middle apartment buildings, 2 to 10 units, that are really the workhorse of affordability, and too many cities have made impossible to develop.
A little bit about healthcare. This argument so far has been kind of an abstract one between a mixed system, a Medicaid for all or Medicare for all, a pure free market. How does cost disease fit into your solution to healthcare and healthcare costs, which have been rising?
Yeah, health insurance premiums are going up about twice as fast as wages in this country. It is suffocating not just families, but also employers and municipalities. It's actually really a hidden public debt issue with municipalities and their ability to deliver services when their insurance premiums are going up so fast. The key is to first understand where is cost in the system, right? Like, it's $4.5 trillion, like, where is cost? And the simplistic answer is the cost happens in hospitals, in nursing facilities, particularly long-term nursing facilities, and in jails, which in many parts of the country, including Massachusetts, have really actually become the largest providers of mental health and substance use treatment. So the key is, how do you keep people out of hospitals, nursing facilities, and jails, right? Like, what are the interventions you can do that keep them away from the most expensive sites of care? And there's a whole slew of initiatives. There's telehealth and hospital at home. Anytime you get generic prescription drugs or over-the-counter drugs that keep people away from inpatient services, that's a cost saver. Pairing first responders with integrated behavioral health and substance use management help keep people away from jails or recidivism from jails. By the way, Jen, all of these things I just said are things that are going to get way harder under this MAGA bill, because they're basically starving Medicaid's ability to be at the forefront of this more progressive view of health and social spending. And I'm from Massachusetts. Mass Health, our Medicaid agency, I would argue, I'm biased, but I would argue has been literally the best in the country at doing this. The forerunner of Obamacare, has used waivers to really experiment with community behavioral health and with long-term services and support and with primary care and a capitated model, really innovative stuff. And it's just going to all get harder now, because we're not actually saving any healthcare money in this bill. What we're doing is we're taking a bunch of healthcare spending that was at least partially subsidized by the richest, and we're putting it squarely on the middle class now.
A little bit about your district in particular, what it's going to do for individuals, hospitals, both on the healthcare side and frankly on the SNAP side, where giving people good nutrition would seem to be a basic fundamental requirement of a healthy, productive economy.
Yeah, it's a few things from my district, like I think with most congressional districts. First, it's an absolute sucker punch to hospitals. I mean, this really is like it's right in the solar plexus of our hospitals for a whole lot of reasons. They are going to be under a lot of strain and are going to need to, I think, adapt faster in their adoption of technology than probably they even really envisioned. And but it's going to lead to reduced access. It's hard to argue otherwise. Number two, it's going to raise health insurance premiums on the middle class. I want to be very clear about this, because while it's important to talk about the 10 million Americans who will lose health insurance under Medicaid, and that's a travesty, those people still get sick, right? And they still go, now they're just going to go to emergency rooms. The exact opposite of what I said earlier about deflection from expensive sites of care. Oh no, now they're going directly to the most expensive place in the world, literally, to get medical treatment, which is the emergency room of a major hospital. And that gets cross-subsidized as uncompensated care in the form of higher insurance premiums to commercial payers. The middle class pays for that. And they're already are suffocating under the rising insurance premiums. But we can't just talk about how bad this bill is as Democrats. It's terrible. We have to be more proactive about saying what we would do better and different. And I think Medicaid is a great example of that. Not only should we be defending Medicaid, we should start talking about Medicaid actually as maybe maybe the best vector for some of the policies that we care a lot about delivering, for example, Social Security for kids through Medicaid, pairing up primary care and community health centers with SNAP benefits, with savings accounts, with wraparound educational services, all through the Medicaid vector, and really reaching that under 18 population.
Fascinating. One of the other aspects of this bill that is so alarming is if you count up all the places in this bill, spending upwards of $150 billion on a immigration system that seems to be chaotic, disruptive, rooting out and deporting working people, not criminals. How concerned are you about a couple of the industries, which happen to be the ones that you mentioned? One is healthcare workers. Many undocumented people work in that sector, food, and also in the construction industry, housing. What is that going to do to those sorts of industries?
It's already happening. Don't quote me on these numbers, but something like 40% of the construction workforce in Texas and Florida, for example, are undocumented. It's not quite so high, but it's still double digits in almost every state in the union. And even the workforce that has documentation is being deterred from labor force participation because they're afraid of these raids and that they can be wrapped up as collateral. Hard to blame them. So you're going to see reduced workforce and workforce participation from our immigrant community, particularly in construction, as you said, hospitality, and healthcare. And this is already at crisis levels for the nursing facilities. I've been meeting with them on a persistent basis. If you ask a nursing facility CEO, what's your job? They don't say, oh, my job is I've got to go out and make sure I'm filling all the inpatient beds I have. There's more than enough demand for nursing facilities. We're a graying country. There's a lot of demand for long-term habilitative or rehabilitative services. Their job is to sell workers on working there. That's what they have to pitch, is getting enough workers to actually accommodate their demand. And that has gotten so much harder in recent months because of these raids. And it's going to raise cost of care and reduce quality of care for the middle class.
Last subject I want to talk to is about the states. The states are kind of left holding the bag here. If they have, and the counties as well, which in some states are responsible for healthcare and food. What is this going to do to Massachusetts' budget as they have to divert funds to food, to healthcare, to other things, and they won't have that money to invest in universities, education, technology, other things that could make the economy more productive?
As you said, the money's not there at the state level. I mean, Medicaid is more than half of the Massachusetts state budget. It's not going to be able to backfill every dollar, particularly, I think, the hospital funding dollars. It's going to lead to, I think there is, of course, the dire scenarios of really underfunded hospitals and nursing facilities. There's also, I think, a healthy imperative here of really pushing the envelope and adopting technology and thinking differently about the provision, particularly moving inpatient services to outpatient or at-home services to try to both improve patient satisfaction and reduce costs in that mechanism. And so it could be that crisis becomes the mother of some of the necessary innovation, but there's no doubt that this is going to be a tough couple of years. Mass Health is very well run, is very competently run, and I think they're going to be able to manage this as best as possible. But they're being given a really tough set of policies, because it'd be one thing for the federal government to say, hey, listen, we're spending too much on healthcare and we got to work together better, Medicare and Medicaid, on how we lower the cost of healthcare. And we're going to give you more flexibility, but we're also going to give you more accountability. Okay, you can make that pitch. That's not what happened here. What's happening here is the states are being given more accountability, but not as much flexibility, and that's unfair.
Right. Well, it's going to be, as you say, a hard road for many of us. I look forward to talking to you in the time ahead. And as we talk about innovation and experimentation, unfortunately, the other thing we're doing, of course, is madly cutting grants to universities, research, real science, and that has to be a recipe for long-term decline for the United States. You, who I know has had startups and has been at the forefront of innovation, that's just not the way to grow our economy. So Thanks so much. We really appreciate talking to you, and we'll have you back soon.
Thanks, Den. Take care.